pregnancy prevention is a key part of reproductive health. Whether you're not ready to have children, or you simply want to plan your family at the right time, it's important to know your options. In this video, we'll talk about safe, effective, and medically approved ways to prevent pregnancy, from natural methods to modern birth control techniques. Welcome back to Nursing, Health and Lifestyle, where you get all tips to health and a healthy living. Let us proceed. There are different methods to avoid unwanted pregnancy. It is absolutely not proper for you to bear children you are not ready for, which is why this is brought to you today. We will be looking at the first method to prevent pregnancy, which is the natural method. Now let's start with the natural or traditional ways of preventing pregnancy. These don't require medication or devices, but they need discipline and proper understanding of your body. Abstinence. The only 100% guaranteed way to prevent pregnancy is to avoid sexual intercourse. This method is much advisable for the teenagers, because there is still a long beautiful life ahead of you, and pregnancy is not the next in line. Abstinence is the best method to prevent unwanted pregnancy, and also save you from sexually transmitted diseases. Fertility awareness method, FAM. Track your menstrual cycle to know your fertile window, usually around ovulation. Avoid unprotected sex during those fertile days. Withdrawal method, pull out. The man withdraws before ejaculation to prevent sperm from entering the vagina. However, this method is risky, because pre-ejaculate fluid may contain sperm. Exclusive breastfeeding. This is for the new mothers, who is willing to space childbearing in order to give room for the proper care of the child. Exclusive breastfeeding can delay ovulation and prevent pregnancy within the first 6 months after birth, but only if done correctly and exclusively. The second method you can adopt is the barrier method. Barrier methods work by preventing sperm from reaching the egg. They're easy to use and widely available. Male condoms, the most common method. It not only prevents pregnancy, but also protects against sexually transmitted infections, STIs. Female condoms, worn inside the vagina before intercourse. They offer dual protection like male condoms. Diaphragm or cervical cap. These are inserted into the vagina before sex to block sperm from entering the uterus. They are more effective when used with spermicide. The third method is the hormonal method. Hormonal methods are some of the most effective ways to prevent pregnancy. They work by stopping ovulation or thickening cervical mucus so sperm can't reach the egg. Birth control pills, taken daily at the same time, very effective when used correctly. Contraceptive injections, like Depo-Provera, taken every 3 months by a healthcare provider. Contraceptive patch, a small patch worn on the skin. It releases hormones into your body to prevent ovulation. Vaginal ring, a flexible ring inserted into the vagina for 3 weeks, releasing hormones steadily. Implant, a small rod placed under the skin of your arm that can prevent pregnancy for up to 3 years. These methods are highly reliable, but should be prescribed and monitored by a healthcare professional. Another method to look at is the intrauterine device method, IUDs. IUDs are tiny T-shaped devices inserted into the uterus by a doctor. They're one of the most effective long-term methods. Hormonal IUD releases hormones that thicken cervical mucus and stop ovulation, can last 3 to 7 years. Copper IUD contains no hormones. The copper kills sperm and prevents fertilization, can last up to 10 years. Both are reversible. You can get pregnant again once the IUD is removed. And lastly is the permanent method. For couples who are sure they don't want more children, permanent options are available. Tubal ligation, for women. The fallopian tubes are cut or tied to block sperm from meeting the egg. Vasectomy, for men. A simple procedure that blocks sperm from being released during ejaculation. These methods are safe, but they are permanent, so they should be chosen carefully after medical counseling. Remember, no single method fits everyone. The best way to prevent pregnancy depends on your health, lifestyle, and future plans. Always speak with a qualified healthcare provider before choosing a birth control method. And don't forget, condoms are the only method that also protect you from infections. If you found this video helpful, please like, share, and subscribe for more health and lifestyle education. Let's keep building a healthier, smarter community together.